Ortman Road, Willowton. Your input helps us serve you better.
ادعو إلى سبيل ربك بالحكمة والموعظة الحسنة وجادلهم بالتي هي أحسن. Invite all to the way of your Lord with wisdom and beautiful preaching, and reason with them in a way that is best and most gracious. Join Shabir Pasha every Saturday at 7 p.m. on the show Dawa Dynamics, and every Sunday on the Dawa Chronicles at 9 p.m. remembering the companions of Prophet Muhammad, peace be upon him. Join the discussion, analyze the life, sacrifices and contributions of the Prophet's companions, and learn from their experience.
Audio stream across the world on radioalansar.co.za. The views and opinions expressed by the guest and presenters of Radio Al Ansar are not necessarily the views and opinions of Radio Al Ansar and the Al Ansar Foundation.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
See, I don't need no reason. You provide the healing.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
We did not know what we're supposed to need. We took the time out to teach us, so that the guidance would reach us, and you know it will. Muhammad ya Rasulullah, Muhammad ya Rasulullah, عليك وسلم المولى محمد عليك وسلم المولى.
A'udhu billahi minash shaitanir rajeem. Bismillahir Rahmanir Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh to our listeners on this chilly Saturday morning. It is warming up a little bit. We are here on Radio Al Ansar 90.4 Durban and Pietermaritzburg 105.6 FM. And around the world, we're on www.alansar.org.za. It's the 27th of June, alhamdulillah, and it's also the 11th Muharram 1448. And you are connected to a 1-hour powerhouse medical Pulse show with myself, Shubnum Ismail. So we're here to capture the heartbeat of the community. So ever felt puffy after a long flight, had heavy legs by 3 p.m. or wondered why your legs felt swollen? Well, when you stress, that might be your lymphatic system asking for help. Today we are talking lymph drainage, your body's hidden cleaning crew. No heart to pump it, no headlines, but it moves waste, fights infection, and keeps swelling down. And when it slows down, we feel it. So stick with us, listeners. We'll break down what lymph drainage actually does. Simple moves, you can try at home. And when swelling is more than water retention. So if you ever Google why my ankles are swollen, the show is for you. So let's get flowing. And joining us in studio today is Gillian Freese. Welcome to the show, Gillian. It's great to have you on the Pulse Show.
Thank you very much.
Listeners, Gillian is a physiotherapist with almost 40 years of experience and a partner of over 30 years at the very well-established Freese Clark and Storer practice here in Pietermaritzburg. She's trained across most fields of physio with postgraduate skills in musculoskeletal treatment and women's health. She's also a certified lymphedema and lymphedema therapist, training both the VODA and FGMLD techniques, and is on the National Health Register for complex decongestion therapy right here in South Africa. This year, she stepped down sideways from partnership into more an independent practice. So, listeners, we're going to dive straight in. So, Gillian, can you tell us, for our listeners who've never heard of it, what exactly is lymphatic drainage?
Okay, thank you for the question and thank you for letting me be here. Lymphatic drainage is a technique that you use to help move fluid, the lymphatic fluid, through the body. And it's a technique that is a very gentle technique, and it's not there to hurt or anything, but it's to move fluid from a superficial area through deep drainage vessels and that through to the heart and to be drained out.
So what does the lymphatic system actually do in our bodies?
Your lymphatic system is your gobble-gobble machine. That's the simplest way of putting it. It's the cleanup system. Nobody knows about it until it goes wrong. And when it goes wrong, then you know that you have a lymphatic problem. So it basically moves fluid, waste products, anything that needs to be moved out of the system that lymphatic system does. So it's the cleanup.
And your primary focus is obviously physiotherapy. So how is lymphatic drainage different from a normal massage or deep tissue massage?
Okay, there's a huge difference. So your lymphatic drainage system works on how, or the drainage technique works on how the system's made up of. And if you want me to explain
Absolutely,
that,
go for it.
So basically, there's the simplistic way of, well, you need to understand what the lymphatics is. So you've got your capillary system, your circulatory system. Everybody knows about that. So you've got fluid moving through your circulatory system. It goes into the capillaries, and fluid seeps out of the capillaries. It's a known fact for every person. Okay. Fluid seeps out, and that fluid has to move back into the body. In the olden days, they used to believe it moved back into the circulatory system. It doesn't. In the last 10 years, it's proven that doesn't happen. It has to be moved out by the lymphatic system. Now, to do that, the lymphatic system has got capillaries, okay, little fingers that move around near the capillaries, the circulatory system. And on those little fingers are anchoring filaments. And that's the clue to the massages. The anchoring filaments need to be stretched to open up the fingers of the lymphatic system, and the fluid drains into those fingers, and then it moves down to which there's a full point where you've got your pre-collectors and collectors. They've got valves, and those valves pump the fluid back up through the thoracic duct into the heart, from the heart to your kidneys, from your kidneys to your bladder, and you wear it out. Okay. But the difference for the massage is for the lymphatic system massage, you're only wanting to stretch those anchoring filaments. So it's a gentle technique. It's done you're wanting to move the superficial tissue, the superficial fluid, to move that to the deeper system. You don't have to worry about deep, because your pre-collectors, collectors, your other lymph vessels are going to take the fluid away because it has a pumping system. So you ask the question, what's the difference? A deep massage, you're going deep, you're rubbing the muscles and that. The lymphatic system, you're stretching your superficial tissue to move fluid so it can drain away.
Well said. Why is the lymphatic system called our body's waste disposal system?
Because that's exactly what it does. It picks up anything in the superficial, anything that's needs to be removed. It removes it. It moves it to the lymph nodes. The lymph nodes gobble what it wants and sends the rest off. So it does. It's the cleanup system. It removes all the rubbish. So if you've got bruising, all that stuff, it's removing that. That's what removes the bruising and that sort of stuff.
And what happens when lymph flow gets blocked or sluggish?
Like you said in your introduction, when you get those puffy feet or those puffy hands and that sort of stuff, that fluid that's sitting in the superficial system can't move. Now, that fluid picks up large protein, which is very important. Everybody has that, okay? And if that large protein's not moving with the fluid, the tissue starts then becoming thick and hardened, okay? And that's what happens is your hands start swelling, your feet start swelling, your tissue starts getting firmer and thicker. And you get these heavy tree trunks that don't want to move. And the system then is not working.
So, Jill, let's talk about the benefits. What are the top 5 benefits people notice after you've done the drainage?
So I do most of my drainage on patients who've had a damaged lymphatic system, and we can chat about that later. But the benefits to them would basically be the first instantaneous, and it's instantaneous. Their legs feel lighter, their arms feel lighter. Then the joints start moving better. Pain's never the issue. It's more of a thick, heavy feeling. So they feel lighter. They can move easier. They don't have this discomfort or this rubbing sensation. And basically they start feeling like themselves. Their arms and legs and their part of their bodies are moving better.
And can it help with bloating and water retention? How does that work?
Now, that is a controversial question, because I would say, look, the bloating and that, can it help? I can't say it can't help, but that's not what I do the massaging, the CDT treatment or the MLD treatment. Those are the words we use, manual lymphatic drainage. For bloating and that, You can do it, especially the visceral area. You can do drainage of the stomach and that, and obviously you will feel better. So you won't feel so bloated. But I wouldn't say I would do lymph drainage just because you feel a little bit bloated today. I'd say go and do some movement and exercise, and you would feel better.
I was doing a bit of research on my own about, lymphatic drainage, and I hear it helps immunity. So can you share what's the connection?
Well, you're moving the waste products away. You're getting the lymph nodes cleaned, if I can use that word. It's non-medical, but cleaned, and therefore they can fight infection better. If the system's clogged, basically how we say it, like on a highway when you've got clogged a traffic jam, the traffic can't move. If you get the broken car out of the way, then traffic can move. And that's the same with your immunity. If you can clean up, get the lymph nodes functioning again, then the immunity can fight better again. So yes, it will help.
So how would an individual know they need to have a lymphatic drainage? Does the doctor do any tests or screening prior to referring patient to your practice?
So all individuals' lymphatic system should be working. You won't either know it's not working unless something like flying, where you get your swollen hands, or if you're a runner and your hands block, you'll know you have a sluggish system. It's not that it's not working, it's just sluggish. It's not moving as fast, okay? But how would you need to come to me if you need lymph drainage? You would normally have had something that's gone wrong with the system. So that's where I would come into saying, what can go wrong with the system? First of all, you can have cancer. So your lymph nodes get involved, have cancer, okay? You have lymph nodes removed due to surgery, due to cancer, and that sort. You have radiation, so that affects your lymphatic system. You can have surgery. You have an overload of surgery, and then the lymphatic system can't cope with that overload of fluid, so it's not working properly. Suppose knee replacements, things like that. Drainage gets blocked. That's where you get swelling from surgery, but you also get blocked, so the lymphatic system's not draining so well. And that's cosmetic surgery. Lymphatic system's affected. If you liposuction, lymphatic system's affected. So it's where something's gone in to affect the lymphatic system. The only time where your lymphatics, where a normal person off the street would have a problem, is they were born with primary lymphedema. So you get two types, primary and secondary. And so the primary is you're born where your lymphatic system has got a problem. It's not got enough lymph nodes or the vessels, or it's a primary, and it literally starts at birth, during or puberty or post pregnancy. But there's something wrong with the lymphatic system, and there's also a genetic component to that side. But most people know the secondary, where there's been damage to it, and that's where DVTs is another example where the system's got damaged.
So is it useful for people with chronic fatigue to have the lymphatic drainage?
Everybody's lymphatic system must work well, but I wouldn't say chronic fatigue must specifically come in to have lymph drainage. Does that make sense? There's no harm with anybody using use to work the lymphatic system. It is okay. So it might be sluggish. You have to speed it up. But it's not going to.
How frequent would a patient need to see you?
You learn how to do it. You don't need to see me. If I teach you how to do it, you can then treat yourself. It's not a very difficult system. It's just nobody seems to want to do it simplified. They want to make it more complex. Okay, so your lymphatic system, where somebody's healthy, if you learn how to open your system's open. You don't need to do it again. It's draining. It's what it's meant to be doing. Okay. Another example I give is you've got a gutter and you've got leaves in it. If leaves are in the gutter, fluid can't flow. Take the leaves out, the fluid flows. If the leaves are going to come back in the gutter, well, then you have to take them out again. But if it's flowing, it's flowing. You don't need to do anything more. So your question is how often? They don't need to see me because it's draining. But somebody who's got a damaged lymphatic system, who's got secondary lymphedema, that's very different. They need to know how to manage that system. And if they're not managing, then they do need to come in and get treatment. And it's on an individual basis of how much is required.
So you spoke about oncology patients earlier. You would probably see them more frequent.
Oh, my oncology patients, yes, I do. So with oncology patients, we'd like to see them straight after surgery, so that they can get the benefit of knowing how to drain the system. Okay, we're not wanting to frighten them. They're overloaded with too much information already. But if they know where to come find us and what to do, that's their benefit. So we like to teach them how to open their system, how to look after it. Post-radiation, we definitely want to see them because of the radiation, so we can help them how to help themselves through radiation, post-radiation, and that sort of stuff. And then through their walk, if they're needing help, we like them to see them. So I say to my patients, I'm your walking stick. I'll get you through the problem. As soon as I've got you through the problem, put me in the cupboard, and when you want to find me, you know where to find me. So going to your question, how often? As soon as they know and they're managing and the system's comfortable, their measurements have come down and they're managing to drain, then we put them into garments and then they look after themselves. So the garments is a big part with the lymphatic drainage.
And can lymphatic drainage help with sinus congestion and allergies, or that's just a myth?
It's not a myth. That one is not a myth. With the sinus congestion, absolutely. So what happens is your tonsils are lymph vessels, okay, lymphatic vessels, okay, lymph glands. We use the word lymph nodes. And for your sinuses drain straight down into your neck, and you've got a lot of lymph nodes in your neck, and those lymph nodes are fighting whatever's in your nose, what your sinus have got. If you can keep those lymph nodes open and you can drain them, you can drain your sinuses will improve. So yes, no, it definitely helps with sinus drainage.
I hope, listeners, you are taking points. Gillian, what role does it play for people recovering from surgery like liposuction or possibly cesarean section?
No, it plays a part, because if you're battling, well, post-liposuction, you are going to swell. So our post-liposuction patients are put into garments, compression garments. That's where I come in, because I do compression garmenting. Well, the patients have to be put compressed post-drainage. So yes, they definitely help. Caesars, if they're finding that their legs are swelling and they're battling, their legs are heavy, opening the lymph nodes in the groin will definitely help. But I wouldn't say rushing in post a Caesar is necessary. You've got a baby to look after, you're looking after all of that stuff. But if you're finding that your legs just keep swelling, they're not managing to drain, yes, then I come into the place where I can help. We can do drainage, we put you into compression garments and teach you how to exercise moves to keep it going.
Do you see mums that are pregnant?
I have in my field, because I do women's health as well. I have one twice ladies who are battling because their tummies are heavy. They hang on your groin, your lymph nodes are not going to work because they're getting blocked. Not to sit, how to stand, how to move and keep drainage going. No, that's where my lipedema comes, where you have fat cells that get deposited into the tissue, and it's just a genetic or not hormonal component, and lymphedema can't make lipedema smaller, so it can't make fat cells smaller, but it can help the fluid that gets blocked around the fat cells to drain. So no, can't help with the cellulitis, but can help move fluid around it.
Listeners, we're taking a quick break, and when we return with Gillian Freese, we'll explain what lymphatic drainage actually is, who needs it, and how it can help with swelling, lipedema, and also post-treatment recovery. So don't go anywhere, grab that cuppa, and we'll be back with you shortly.
New every day, Radio Al-Ansar.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickhill Road, Overport. Simplex Radio, the name you can trust.
Listen up, Al Ansar family. Dawood Mega Boutique's second birthday celebration is here, and we're dropping the Golden Mystery Envelope Challenge. Tune in every day from Tuesday to Saturday to grab your daily clue word. Put all 5 words together to unlock the secret phrase. Collect your clues daily, get that phrase ready, and stay tuned to Al Ansar to win big. Your 5 secret words ready for the Darwin Mega Boutique Birthday Challenge? Here's what you do this Sunday, June 28th. The Al-Ansar team will be live at Darwin Mega Boutique, Saxony Westwood Mall from 10 a.m. sharp. The first 5 people to find us and give us the correct final phrase instantly win a golden mystery envelope packed with surprises. See you this Sunday at 10 a.m. at Darwin Mega Boutique, Saxony Westwood Mall.
It's Saturday, and this is your final clue for the Darwin Mega Boutique Golden Mystery Envelope Challenge. After Saturday comes which day of the week? Put all 5 words together to form the final phrase and meet the Al Ansar team tomorrow morning, Sunday, June 28th at 10 a.m. sharp at the Darwin Mega Boutique, Saxony Westwood Mall. First 5 correct answers win.
Doctors and guests on a medical files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
بسم الله بيك نبدا حبك في سلطان جسدي مع السكية عين تسدي تبني شهرة محمد يا سيدي صلى الله عليك يا محمد سيدي صلى الله اللهم صل وسلم على نبينا نجوم الأقوى.
And we're back, listeners. Assalamu alaikum wa rahmatullahi wa barakatuh on this Saturday morning on Radio Al Ansar, 90.4 Durban, MP Marisburg, 105.6 FM. And around the world, you can actually log into www.alansar.org.za. You are connected to the PMB Pulse show, also connected around the world with myself, Shubnum Ismail, capturing the heartbeat of our community. And if you've just joined us, I'm here with Gillian Freese, a Physiotherapist physiotherapist for over 40 years and a certified lymphedema and lymphedema therapist on the National Registrar. We're lucky to have her here at our studio in Pietermaritzburg. So Gillian, let's dive straight in. Can you tell our listeners, can lymphatic drainage help with arthritis, joint pain, or inflammation?
That's a question, it's a difficult question. So lymphatic drainage can help with inflammation. Can it cure arthritis or all of what you've been sharing with me? No, it can't cure it, but it can help make the joints feel more movable, that you can move them easier. But that wouldn't be the first call for why I would do lymph drainage. It can help, but I wouldn't say come rush in to do lymph drainage. I'd rather say come in and do some physio and help get the joints moving and then go from there. I hope that answers that question.
Absolutely. So Gillian, what about lymphedema? How does drainage help people born with it or post-cancer?
Okay. So just to go back to what the lymphatic system, as I said, it's a gobble machine and you're moving fluid from the superficial system. 2 to 4 liters of fluid have to move through the body every single day. Okay. And when the body when the lymphatic system is damaged, that fluid starts filling it. It's like a naughty kid. It wants to find a way out. So it tries to find where it can sit and block. And that's where you get the puffy feeling, the blocked, bloated area. And it can be anywhere in the hands, the arms, legs, feet, the groin, the abdominal region, the breast, the face. It can be anywhere. Now that fluid has to move. And we move the fluid back through to the heart, okay? And from the heart to the kidneys, and from the kidneys, you then wee it out. And if you are doing a drainage correctly, that you will literally want to wee within an hour of you having to do the drainage, okay? So you've got to get that fluid moving, but there are sorts of contraindications you've got to be careful for. To do that sort of drainage, you've got to be careful on someone who's got acute heart failure or acute kidney failure, because then you're putting too much fluid pressure because it's moving back to the heart and it's moving back to the kidneys, and the body can't handle that. So that you can't do. You can't treat those patients in the early stages. I can't remember what the rest of your question was. Sorry.
We can move on, but just to elaborate. So is it safe for people with high blood pressure, diabetes, or heart conditions?
That's absolutely fine. So only contraindication is acute heart failure and acute kidney failure. I will also bring in DVTs, clots, thromboses. You can't do it in the early stages. 24 to 48 hours, they must be under medicine to help break the clot. Then you can work. The same with cellulitis, which is an infection that you can get into the lymphatic system. You can't treat those within 24 to 48 hours. They must be on an antibiotic. As soon as the antibiotic's working, you can get in and you can start draining and get fluid moving in that.
So can it reduce swelling from injuries, sprains, or after workouts?
Yes. So that's where it's becoming very in at the moment, is with your sports treatments and that sort of stuff. Yes, it can. Absolutely, you can get drainage going. So if you get fluid overload, the lactic overload, if you can get that chemicals to start moving, you can get the lymphatic system drainage. Yes, definitely work. That's why you see a lot of the high-level sports players, they're putting the lymphatic pumps on because it's getting the drainage back and it's getting the body to move quicker and function better. So yes, you can.
Question from one of our listeners. So what about headache and migraine to the flow?
I wouldn't put that as the first link. I would say your headaches, your migraines are definitely related to your cervical, your joints, that sort of stuff, or your migraines can be imbalanced, chemical imbalance and that. Can it help? There's no harm in not doing it, but I can't say that would be my first port of call of treatment.
I was actually reading up that a lot of celebrities do lymphatic facial drainage. So what does it do for the face?
Well, it stops the puffiness. So same as with the sinuses. It's exactly the same as what I would do for treating a sinus. It's to get this fluid moving from the facial area into your neck and get the lymph nodes in your neck draining so that the fluid can move. Can it stop you from being puffy? No. Well, if you're going to be partying too much or doing too much that and you're going to battle and you're putting your system under strain, well, then you're going to be puffy. But can it get the fluid moving? Yes.
So ultimately, it can also help with acne and give you a natural skin glow with removal of the toxins.
I wouldn't go with that way. I'm not saying it can't help, but that's not what I do drainage for. My drainage is far more for the medical, the oncology, for damage to your system, whatever's caused damage to your system. Your acne is an infection or a skin irritation, so your lymph nodes are going to be fighting that. So yes, if you open the lymph nodes, they've got more chance of fighting what they're dealing with. So there is a help because remember, it's the gobble machine. So opening the lymph nodes is going to make the body fight the acne better. So yes, it's going to help. But it wouldn't be where I would come dashing in to do an MLD treatment. But as a listener, if you want to just open your lymph nodes in your neck, absolutely, it's going to help.
And for our listeners, can you elaborate about what is the MLD treatment?
The MLD treatment is called MLD, manual lymphatic drainage, and it comes under the name of CDT treatment, which is complete decongestive therapy. And to get that, you have to do 140 hours of certified training to be able to be a qualified lymphedema therapist. And if you are going for drainage and that, I would encourage you to make sure that the person who's doing the drainage is a qualified, who's got their certificate in CDT. So what is MLD? You're then teaching the patient how to open their lymph nodes and do a flushing technique. So where there's an injury to whatever side it is, you're going to flush the fluid to the opposite side or back to the area, but having opened the lymph nodes first. And the technique you're teaching them is to do a stretching technique on the tissue. You're stretching the From there, you then teach them to do bandaging or compression garmenting required. You also teach them to do skin care, because when your lymphatic system is affected, the system is very vulnerable to a thing called like cellulitis and that sort of stuff, and that's dangerous. So cuts or anything like that, you want to look after yourself. Cut on your cuticle, burn yourself from cooking or something, you must put an antiseptic cream on. You don't want to leave it. If you have a mozzie bite and you scratch, your fingers are dirty, they can get an infection, which can then cause damage to your lymphatic system. So you teach them for skin care and all that sort of stuff. And then also you teach them mobility and exercise to move in that. Just breathing is moving your lymphatic system. So we're very much encouraging movement. We don't want you to go and run the comrades, nothing wrong with the comrades, but what we want you to do is just get up and move. Just move. 5 minutes every day is better than not moving at all. And that's the whole system, what we work with. So it's a five-finger system that we try to teach our patients.
And Gillian, speaking about movement, besides massage, what daily habits keep our lymph moving?
Exercise. Just breathing gets you. So we teach patients diaphragmatic breathing, which we breathe from your stomach. So you breathe in, your tummy goes out. As you breathe out, your tummy drops down. That's the correct way of breathing. Most people breathe from their apical, from their upper chest, because they're tense or stressed, but it's not the correct. So if you get your diaphragm breathing, you're getting your system moving. In the olden days, we used to believe that diaphragm breathing would pump the thoracic duct up, but the thoracic duct actually has a valve. It's now been proven it can do that itself. So it's not actually pumping the system, but diaphragm breathing is getting things going, and then moving, walking, exercising. Swimming is your best form of exercise for a person who does battle with lymph drainage. Why? Water's got compression, and compression's like wearing a compression garment. So if you are a person who's got lymphedema, you have to exercise with your compression garment on, because we all know when you exercising, your system is getting hot, so the circulatory system has to cool you down. By cooling you down, more fluid comes out of the capillaries, more fluid is in the superficial system, so you've got more lymphedema. So when you're exercising with lymphedema, you need a compression garment, but if you're swimming, you don't need, but it's compressing, so it's helping you. So swimming is your best form of exercise for that.
So can dehydration slow down lymph flow, and how much water do we need?
Okay, so no. So the dehydration is not good. You need to be well hydrated. We all know that. For everybody, you have to be well hydrated. But drinking or not drinking is not going to change how that lymphatic system's working. That lymphatic system is damaged because the lymph nodes are damaged, because that area, the lymph nodes can't take the fluid away. But yes, you must drink, you must be well hydrated, but drinking less or drinking more is not going to affect the system, as is the same with protein. Eating more protein or less protein is not going to affect the system, because remember in the beginning I said protein also has to move with the fluid, and that protein with the fluid causes the tissue to get thicker, and so that doesn't affect it as well. So just a healthy, balanced diet is all we request.
So do you work with the multidisciplinary team? Do you work with the dietitian? And let's talk about the dietitian side. So what foods help or hurt lymphatic health?
We just say eat a healthy diet. That's basic. Don't make it more difficult than it is. Just eat a healthy diet. With your lipedema, that's different. That's your fat deposit. That's completely different. And that we would definitely say ketos diet and that sort of stuff. So do I send patients to dietitians? Absolutely, I will, especially your overweight patients, because now they're dealing with other problems as well. So the lymph flow is battling to move through the tissue, and we would then encourage a healthy diet, because the better your weight is, the better the system can manage, because it hasn't got other complications that are coming in.
So, do tight clothes for our ladies, like wear bras, do they block the lymph, or what should we avoid wearing?
Okay. So yes. So when I teach my patients who come to me who've got damaged lymphatic systems, the one thing I do have, sorry, I'm going to say it now, no wire bras. We don't like wire bras. Wire bras are going to constrict the lymph flow. We also encourage a wide, under the armpit, a wide tissue material there, so it puts compression, and we also encourage a wide strap, so it's not digging into the system there. So wire bras, yes, we don't like. Tight panties and that, we don't like. Why? Your lymph nodes on your groin, they're going to get blocked because your tight panties are blocking your lymph nodes there, so we don't encourage tight clothing in that sense. But then I'll get told, but you're contradicting yourself, Jill, because you're saying wear compression garments. Yes, the compression garments are different to tight clothing. Compression garments are specifically made to push the fluid up, back into the lymphatic system, back to the heart, into the kidneys. So a compression garment that is a firm fit is very different to tight panties and tight bras and tight clothes.
So do you see patients in all age categories, or majority in the latter part of their life?
No, all age categories. I see all age. So you can get primary lymphedema, which can be children, babies, okay? And you can get secondary lymphedema, which can be patients who've been affected by whatever surgery, oncology, whatever reason, from in their childhood through up till 90-year-olds. I'm recently treating a 94-year-old.
And listeners, we're going to take a quick break. Gillian will be back shortly to unpack lymphatic drainage and why your lymph system matters to us. We'll be back shortly.
Sunfoil has nurtured a legacy rooted from our land. From a sunflower seed grown with goodness and love, crafted through excellence, precision, and care. Proudly South African, and the only 100% pure sunflower oil endorsed as a diamond partner by the Heart and Stroke Foundation. Cook with confidence, serving the best to the people you love, from one dish to the next. Sunfoil, the heart of good cooking.
It's our second anniversary, and Dawood Mega Boutique is celebrating 2 years of quality, value, and community. You're invited to join us for a wonderful, fun-filled family day in store. Bring the kids along for a day packed with exciting in-store competitions, awesome free giveaways, and delicious free tasters of your absolute favorites. We're rolling out never-to-be-repeated deals across the entire store. Plus, don't miss our urgent, unmissable, hourly specials on specific items. Once that hour is up, they're gone. Get unmatched value from our premium butcher, our fresh deli, crisp fruit and veg, and of course, our massive frozen food selections. It's your complete grocery destination all under one roof. Mark your calendars, bring the whole family down, and leave happy. Dawood Mega Boutique, 2 years of serving you with excellence, and we are just getting started.
This and only this is Nightline. Nightline is the only program that allows you to listen to the opportunity to voice your opinion on any matter or any topic that concerns you. Also on Nightline, we interview the famous, the not so famous, and infamous. Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Brother Muhammad Variawa, and with me in the studio is Dr. Anwar Jiwa. Join us every Saturday night from 8:30 p.m. till 10:30 p.m. on Nightline, the program designed especially for you, the listener. Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
You are listening to a live broadcast from Radio Al Ansar, Pietermaritzburg, 105.6 FM.
That's so long. He makes the crowds cry. He comes as he's tired. He makes the wind dry. That's Allah. Which of the favors of your Lord can you deny? Read his words. He's the creator, the master, the majesty of the universe. La ilaha illallah. 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 When life's a hard fight, and when we lose sight, and make it alright, that's love. We can never lose hope, 'cause we're never alone. When it's wrong, that's love. Which of the favors of your Lord can you deny? Read his words. He's the creator, the master, the majesty of the universe. La ilaha, la ilaha, la ilaha, do we ever wanna better things around us? Everything is worth it.
And we back, listeners. Assalamu alaikum wa rahmatullahi wa barakatuh. And we are at the studio in Pietermaritzburg, Radio Al Ansar 90.4 and Pietermaritzburg 105.6 FM. And around the world, www.alansar.org.za. You're connected with myself, Shubnum Ismail, and we are on the Pulse Show, capturing the heartbeat of our community. So today we are talking about lymph drainage with Gillian, Freese, physiotherapy, with over 40 years experience in our city of choice. And we're going to just revisit some of the things that she covered before the break. So Gillian, can you tell our listeners who is an ideal candidate for lymph drainage in terms of maybe diagnosis and any ill health? Can you just maybe revitalize and tell us what it's all about?
Thank you. A person who needs to come for lymph drainage is somebody who's had their lymphatic system affected by surgery, by infection, by damage to that system, and they're battling with swelling in their arm or their leg or their stomach or their face or their groin, and they're noticing that the arm or leg is getting bigger, the clothes are getting tighter, they're uncomfortable, their joints are battling to move. Those are the patients we're saying, please come, there is help. The sad part is I can't cure. I cannot put back lymph nodes that have been radiated or been removed or have had infection or have had a clot or something like that. But what I can do is I can improve the quality of life. And that's your living stand, how you're enjoying life. We can teach you how to open the lymphatic system, teach you how to open it. And it is simple. It's not difficult. And then you can go out and look after yourself. So those are the patients who say, please come in. If you've had a joint replacement and your knee's not going down, the swelling's not going down, it's a knee replacement, and you're battling, your leg's swollen, come in. We can make that feel better. We can get the drainage. Like I said earlier, I've got to remove the leaves out of the gutter and the fluid can move. And that's what we do, is show you how to get that system going.
So what's the difference between manual lymphatic drainage versus machines or boots?
Okay, yeah. So first of all, cost. Okay, your machine are expensive, 15 to 30,000. Okay. In the olden days, 25 years ago when I was training, we didn't use the machines. They didn't have the system because they weren't pumping correctly. The new machines are doing so much better. They will pump up the leg or up the arm. Okay, so you can get a machine, a machine pump. The only difference is you still got to open up your lymph nodes. That's the clue. You can stick the machine on and it's pumping the fluid to the lymph nodes. And the lymph nodes are looking at you and saying, well, what must I do? Because I'm full. Okay, so you still got to do hands-on. You've got to open up your lymph nodes, and then you'll flush. So instead of flushing, you just get an expensive machine and put the machine on. So both of them work. It's just hands-on, much cheaper.
So, Gillian, can you enlighten our listeners? Are there side effects? Are there risk involved?
The only risk you have to be careful is acute cardiac and acute renal failure. That you've got to be careful of. In my years of doing this, I was trained there's no side effects. I have to admit some patients who are very sensitive might have a reaction, might get gastro, might feel nauseous, might get a headache. Because remember, we're moving toxins, so that can happen. So even though we're told it cannot happen, I'm not going to say it doesn't happen, but it's a once-off the system. It means that system was very blocked, very sluggish, and wasn't managing very well. But if you drink more water, you'll get the system going, you'll feel better, okay? So that would be the side effect. Otherwise, there is no side effect. It is not painful. No lymphatic drainage should be painful. It is a wonderful technique that stretches the tissue, moves the fluid to lymph nodes, and the lymph nodes gobble. I suppose the side effect, if I have to be, is you'll go for a wee-wee. You'll want to go and wee all the time. And that's fantastic because you've got these filled up arms and legs. You just want the fluid to get out. So you go and wee and it comes out. So that's your side effect.
And is the treatment painful? Take us through what would someone expect during a lymphatic drainage system?
So, sorry, I jumped in and said no straight away because I get quite frustrated when people are hurt. No, there is no pain involved. You're gently stretching the technique. With the latest training that I've had, you can use your hands. That's the general way of treating. I use balls. Big soft balls, and you put them in your armpit and you squeeze them. You put them in your neck and you squeeze them. You roll them in the neck. You put them in your elbow. You put them behind your knee. You put them in the groin, and you squeeze the ball. That's opening the lymph nodes. You only have to squeeze it 4 times, and the lymph node is opened. And then you use the side of your hand and you gently stroke your tissue towards the lymph nodes to get fluid moving. And that's all that's expected. So if someone comes to me, obviously we'll have to assess them, and that we measure the legs and arms or whatever the problem is, and we teach them how to open the drainage. And it's a gentle technique.
So how can someone tell if their lymph system is sluggish without seeing a therapist?
If you're a runner and you find that your hands swell when you're running, that's a lovely example. If you're somebody who flies lot and you person who comes off and says, oh, look at my swollen toes and swollen feet, that tells you you've got a sluggish system. If you're somebody who's sitting at a desk and you work all day and you stand up and you've got these tree trunk legs, they're swollen and they're battling, your system's sluggish.
So, Gillian, I'm going to take advantage of having you here in studio today. So while our listeners are sitting in front of the heater tonight or just maybe watching the soccer game, what's one simple self-massage technique listeners can try at home tonight?
That is so difficult being on radio, not being able to show. But I would say with your hand, if you put your hand at your neck, between your neck and your collarbone, and you do gentle technique, round technique circles of massaging towards your collarbone. In your armpit, you do gentle round techniques, massaging in your armpit, and gentle round techniques in your groin. That will open up your lymph nodes and get the lymphatic system draining.
Well, my technician and myself, we're nodding. We're going to actually try that a bit later. So, Gillian, we're coming towards the end of the show. Last one. If you could tell every South African one thing about lymph health, what would it be? And is there any advancements in medicine? I know that I love asking this question to my medical professionals. There have been AI and so many changes with medicine. Is there anything that you'd like to add?
What I would like to add is patients who are battling with swelling, swollen arms, swelling, please go to a CDT-trained lymphedema therapist, okay? That's important. It must be somebody who's trained. They must have their certificate. On LIASO in South Africa, it's the Lymphedema Association of South Africa, you'll be able to pick up all the trained lymphedema therapists, and we will be those who are trained on the national health listing. So your medical aids will know that you are trained, sort of thing. I would say go and get help. There is help out there. A lot of the doctors aren't aware of what we can do to help the patients. So go and get help. That's what my home thing is. Go and get help because there is help. We can't cure, but we can help you.
Gillian, thank you for making lymphatic drainage so clear for us and our listeners today. And how can listeners get in touch with you and where you're based in Pietermaritzburg?
I'm in practice in Pietermaritzburg, FCS practice in Maritzburg and in Hilton. And You can find us on the website. You can find us on WhatsApp, Facebook, and do I give a telephone number?
Absolutely.
My telephone number, which contacts wherever I am, is 033 345 3177.
Thank you so much, Gillian. To our listeners, shukran for tuning in today's episode of The Pulse. If you're dealing with persistent swelling, heaviness in your legs, know that help is available. Early action changes everything. Jazakallah to our team of technicians, both Pietermaritzburg, Durban. Stay tuned until next Saturday. Have an amazing weekend. Assalamu alaikum wa rahmatullahi wa barakatuh.
Program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Radio Al Ansar, 24/7, 365.
Gentlemen, it's back.